Which of the following patients is most at risk for the development of a hiatal hernia? A. An 80-year-old obese male who loads trucks for work. B. A 35-year-old pregnant woman with a gastrointestinal tumor. C. An obese male who smokes cigarettes. D. An 80-year-old obese woman with alcohol-related ascites. E. A 30-year-old male professional athlete. The answer is D. An 80-year-old obese woman with alcohol-related ascites. Advanced age, female sex, obesity, alcohol abuse, frequent heavy lifting, pregnancy, gastrointestinal tumors, and smoking may increase an individual's risk for the development of a hiatal hernia. The correct scenario represents 4 risk factors. The nurse cares for a patient with appendicitis. Which of the following positions is best for improving breathing and relieving abdominal pain? A. Trendelenburg. B. Reverse Trendelenburg. C. Fowler's. D. Side lying. E. Sims. The answer is C. Fowler's. Fowler's position, head of bed, HOB, elevated 45 degrees, increases comfort, ventilation, circulation, and relieves pressure from the thorax. It would be best for this patient due to the pain experienced by the patient in the abdomen. Sims position, halfway between lateral and prone, upper arm flex, lower arm behind patient, is used when a patient is receiving an enema or an examination in the perineal area. Trendelenburg, HOB lowered, feet elevated, is used for patients with hypotension, as it promotes venous return. Reverse Trendelenburg, HOB elevated, feet lowered, is used to promote gastrointestinal problems by minimizing esophageal reflux. Side lying, patient on side with top leg in front of bottom leg and hip, knee flexed, is used to relieve pressure from the sacrum and is often rotated with patients who are on bed rest. A 35-year-old client is being discharged post-hemorrhoidectomy surgery. The nurse is explaining in detail all discharge instructions to be followed for a successful post-operative period. The client will need to adhere to which of the following instructions? A. Avoid pain medications post-procedure as they may cause constipation. B. Avoid bowel movements until sutures are removed. C. Use of daily enemas to promote frequent bowel movements. D. Take oral pain relievers prior to bowel movement to reduce discomfort. E. Use of rectal suppositories in place of oral stool softeners. The answer is D. Take oral pain relievers prior to bowel movement to reduce discomfort. To prevent pain during a bowel movement post-operatively, pain medication is often indicated to help make it more tolerable. Pain medications will need to be given post-op and may contribute to constipation, but oral stool softeners and a high-fiber diet can help to avoid the constipation. Rectal suppositories and daily enemas are not needed. Bowel movements should not be delayed nor avoided in the post-operative period. A client is being treated on the medical surgical unit for pneumonia and has recently developed severe diarrhea. Upon cultures performed, it has been determined the client is now carrying Clostridium difficile, C. diff, and will need to be on special precautions to prevent the spread of this disease. All of the following are consistent with the appropriate precautions when dealing with those infected with C. difficile except A. All persons having direct contact with the client will wear a mask, including healthcare workers and visitors. B. Healthcare providers, as well as visitors, will put on gloves and wear a gown over their clothes while interacting with clients with C. difficile. C. Hospital rooms and medical equipment that have been used for clients with C. Difficile must be disinfected and cleaned thoroughly. D. When possible, client will occupy a private room or share a room with another C. Difficile client. E. All healthcare persons interacting with the client will wash their hands with soap and water or alcohol rub prior to contact. The answer is A. All persons having direct contact with the client will wear a mask, including healthcare workers and visitors. This client is to be aware on contact precautions. The wearing of a mask is consistent with airborne precautions, which is not necessary for C. diff. All other choices are appropriate for contact precautions. Overdose of which of the following over-the-counter medications is one of the leading causes of liver failure in the United States? A. Diphenhydramine. B. Acetaminophen. C. Loratadine. D. Cimetidine. The answer is B. Acetaminophen. Acetaminophen causes more liver failure in the United States than viral hepatitis, making it one of the most common causes of liver-related emergency room visits. It causes approximately 78,000 emergency room visits and 150 deaths due to liver failure each year. None of the other medications listed are associated with liver failure. The majority of hepatic infections are with which of the following type of microbe? A. Bacteria. B. Fungi. C. Prions. D. Viruses. The answer is D. Viruses. The majority of liver infections are viral in nature. Hepatitis A, hepatitis B, and hepatitis C are the most frequent agents of infection, with hepatitis C being the leading cause of liver transplants. Bacterial infections in the liver most commonly take the form of an abscess. Fungal hepatitis and prion infection of the liver are not generally seen. Which of the following viruses can cause hepatitis? A. Yellow fever. B. Cytomegalovirus. C. Epstein-Barr. D. All of these. The answer is D. All of these. There are multiple viruses that can cause hepatitis other than hepatitis A, B, or C. Among these are Epstein-Barr virus, cytomegalovirus, and yellow fever. You are the nurse for a new patient brought to the emergency department for a suspected gastrointestinal bleed. The patient is tachycardic and hypotensive, but conscious, responsive, and breathing spontaneously without any airway trouble. Which of the following is the best initial intervention? A. Insert 2 large bore peripheral IVs. B. Prepare to intubate the patient. C. Administer hydromorphone. D. Administer lorazepam. E. Administer warfarin. The answer is A. Insert 2 large bore peripheral IVs. This patient is suffering from a suspected gastrointestinal bleed, and based upon the report of the vital signs, he is hemodynamically unstable. In evaluating an emergency trauma patient, the ABCs must be assessed: A. Airway, B. Breathing, C. Circulation. In this patient's case, it is stated that he is responsive and breathing without any issues, indicating that his airway and breathing are both satisfactory. The next issue is his circulation. Given that he has a suspected bleed, and is tachycardic and hypotensive, it is likely that he is losing a significant amount of blood from his bleeding viscera. As such, he may need emergent, rapid fluid and/or blood product resuscitation. The best way to prepare for this immediately is to place 2 large bore peripheral 4 lines, such that resuscitation can be provided through these lines while the rest of the workup and treatment continues. Any delay in placing these lines delays the fluid, blood resuscitation of the patient, which can be dangerous. At this point, given that the patient has a protected airway and is breathing without issue, intubation would not be indicated. Should his airway or breathing status change, the need can be reassessed. Administering hydromorphone, a potent opioid, may be necessary if the patient is in a significant amount of pain, but that would not be the most pressing initial concern given that he is hemodynamically unstable. Administering warfarin, an anticoagulant, would be highly contraindicated in this patient, as he likely has an active gastrointestinal bleed and is hemodynamically unstable. Administering lorazepam, a benzodiazepine, is not indicated in this hemodynamically unstable patient with a suspected gastrointestinal bleed. After stabilization and continued demonstration of airway protection, if the patient is anxious, this need can be reassessed. You are the nurse taking care of an 83-year-old patient with a history of gastroesophageal reflux disease, GERD. They complain that they are having heartburn symptoms at night when trying to go to sleep and in the morning when they wake up. In addition to addressing their medical therapy options, you recommend which of the following to the patient? A. Do not take calcium carbonate for symptomatic relief. B. Avoid spicy foods before going to bed, but otherwise eat a whole meal right before going to bed. C. Eat your last meal at least 3 hours prior to going to bed, and sleep as upright as possible, with multiple pillows. D. Eat immediately prior to going to bed. E. Drink 1 cup of coffee prior to going to bed. The answer is C. Eat your last meal at least 3 hours prior to going to bed, and sleep as upright as possible, with multiple pillows. This recommendation involves fairly simple lifestyle changes that have the potential to greatly decrease the patient's symptom burden. Heartburn symptoms can be exacerbated in patients who eat spicy foods, at any time, who drink coffee, and/or who eat meals shortly prior to going to bed, since the food can physically reflux back to the distal esophagus from the stomach prior to being digested more completely. Thus, any of those recommendations would be inappropriate. Further, in a patient who is acutely experiencing acid reflux symptoms, it is typically appropriate for them to take calcium carbonate to neutralize the acid and relieve symptoms. As such, advising the patient to not eat immediately prior to going to bed, and to remain upright, to physically minimize reflux of contents, would be the most appropriate recommendation. You are a nurse at an oncology infusion center taking care of a 45-year-old female with breast cancer, currently being treated with chemotherapy. While receiving her chemotherapy infusion, she complains of severe nausea. Which of the following medications would be most appropriate to treat this patient's nausea assuming she has a normal QTc interval? A. Acetaminophen. B. Ketorolac. C. Ibuprofen. D. Meloxicam. E. Ondansetron. The answer is E. Ondansetron. This patient, who is actively being treated with chemotherapy and experiencing severe nausea, is most likely suffering from chemotherapy-induced nausea. The most appropriate first-line treatment for chemotherapy-induced nausea in a patient with a normal QTc interval is ondansetron, also known as Zofran. Ondansetron is a serotonin 5-HT3 receptor antagonist, likely accounting for its anti-nausea properties. A side effect is QTc interval prolongation, and as such, careful consideration as to whether or not to prescribe ondansetron should be given for patients with baseline prolonged QTc intervals. Acetaminophen, an analgesic, Would not treat nausea, nor would ibuprofen, meloxicam, or ketorolac, all NSAID medications.